So for this episode, I'd like to welcome to the podcast Chad Henry. Dr. Chad decided to make sure.
Of course, man. It's all good. It's all good. I think in med school too, like because you're learning by organ, like organ system by organ system, it's very isolated. But in real life, I got assigned to the patient before I even got in. So like everyone's messaging me like patient's agitated, blah blah blah. Like, and then someone's calling me. They're like, "Yo, we're gonna call a rep if you don't get here, if you don't get down here soon." And I was like, "Bro, like I don't even know what to tell you." Like everyone's talking to her, she's not waking up. Like she was fine like an hour ago. Like everyone's freaking out. I was like, "Mademoiselle, like sac passé, some nonsense." Like, I said something, and then she woke right up, and she was like talking in Creole, and I was like, "This is all it took."
How have you kind of felt about like the way intern year went for you, and like kind of the way that's usually run?
Yeah, I mean,
hey, my name is James Charpentier, and welcome to Less Than 3%. We talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I'm very excited as we're going to get into another interview. And you definitely want to stick around for this one because this is basically a first for the podcast. So without further ado, let me just go ahead and introduce today's guest. So today's guest, he is number one, a physician. So this is going to be the first physician we've had on the podcast. He's an internal medicine second-year resident at Mount Sinai Morningside West, who has a passion in critical care medicine, social justice issues, and community health advocacy. He's from Bolden, Long Island, and he graduated from the CUNY School of Medicine as a part of the class of 2023. And so for this episode, I'd like to welcome to the podcast Chad Henry.
Thank you so much. This is amazing. I think this podcast is cool. I think Less Than 3% is a great thing that you're doing. I'm happy to be here. Let's get started, man. I'm looking forward to it.
Yeah, for sure. No, I appreciate you coming on the podcast, especially because you're the first physician on the pod. I've been waiting for that for a while, crazy. So I'm super honored to have you on here today.
Man, I'm honored to be here.
Yeah. So I know I gave a bit of an introduction at the beginning, but would you mind giving everyone listening here an introduction to you?
Yeah, I mean, I grew up in New York, so I was in Brooklyn for some time. Then I moved to Long Island, and then, Harlem for school. But yeah, I mean, generally speaking, I'm pretty chill. People think I'm a cool guy. And yeah, at this point, I am a second year residency, and I'm interested in critical care, but I try to find time to devote myself to the community as well. That's another passion of mine. Something that I try to keep all throughout school, and then try to keep throughout residency, hopefully continue in the future as well. But yeah, I mean, I think everything else will come naturally as we start talking about other stuff.
Yeah. Yeah, definitely. Thanks, for a bit of introduction. Yeah. Also, I realized when I said the bio, I should have come correct. I didn't say Dr. Chad. Just had to make sure.
Yeah, so of course, man. It's all good.
But so going off of that, obviously you've talked a little bit about like some of your background and some of those things, and of course you being a physician now, taking care of patients. Where did all that start at the beginning? Like, what got you introduced into medicine?
So it all started when I was born. No, I'm kidding. But basically, let me see. I think I had a lot of exposure to medicine, like from my family. Basically, everyone in my family is like nurses and stuff. And I've always had a passion just for like biology, physiology, stuff like that. I always thought it was cool. I also had a lot of family support in terms of pursuing this field. When I decided that I wanted to go somewhere down this route, my family is very excited. They're from Ghana and West Africa, so they're really excited to hear that I was pursuing something in the sciences. And I guess throughout high school, I got more and more exposure to the healthcare setting, and I came across Sophie Davis and other combined programs across the country. Did a lot of shadowing experiences, and I realized like medicine is definitely something I could see myself doing. And then throughout Sophie is kind of when I developed my passion for community like advocacy. I really came into that community outreach, being the grassroots involvement, stuff like that. Being black in medicine is particularly special. I feel that every day actually as I work. It makes a huge difference being black in medicine, and I'm happy to be doing what I set out to do. I'm happy to like I'm making a difference just by being there and showing up. For the people in my community. Um, so yeah, I think that kind of summarizes my journey to medicine, and still ongoing.
Yeah. So there's definitely a lot there.
Yeah,
And I think it's very interesting, like how you mentioned, especially like the community aspect and how that kind of tied into your interest into the impact you're trying to make in medicine. If we go a little bit more on that side of things,
Sure.
What would you say were perhaps maybe like the biggest influences, perhaps, or whatever? What would you say was maybe the thing that drew you the most, or if you can name like a particular experience that you've had or anything like that you felt kind of got you more, not just looking to be a physician, but specifically thinking about like the grand scope of community health?
So yeah, I mean, when I was in Sophie, I think, let me see, was it my second year? Either first or second year, I got involved in some experiences in the neighborhood in general. It's honestly every year at Sophie there was a lot of stuff to do, and then COVID hit, and then that kind of limited things. But like early on for me, like 2016, 2017, I got involved with like this food pantry area like down the street. It was like 124th or something like that, and I would go there like every Thursday, hang out, food. We watch movies. This was like people who would come who are like disenfranchised. They would come and get food, and we all hang out. It was a cool vibe, and it was nice to being like connected to the community in that sense. Like I actually felt like I belonged here, and I was like making a difference here. So that was cool. And then there was like In Arms Reach, and there are a lot of programs that have like kids coming to the building here, and you tutor them or you like help them with their homework. I think a lot of the kids had like parents who were incarcerated, so they weren't in the best situation. So it's good to be like a good role model for them. Have something to like positive to look up to. A lot of the high schools in the area also have programs, so I like tried mentoring at the high school right across the street. I tried mentoring at a couple different elementary schools. Which Switch It Up, Break It Down was another one. Where you taught kids how to like do healthy habits for eating, exercise, stuff like that. So all these things really like ignited my passion, and it just kept on like fueling it throughout school. It was a great break from the studying too. It was very fulfilling. And like I said, the kids are like black and brown, so it really makes much of a difference where I'm black, and also being there, showing them that, you have something to like look up to. We're here for you as well. You have black role models and stuff like that. And like I did it, you can do it too, kind of thing. Like it makes a big difference when you see someone that looks like you doing certain things, because it's hard sometimes when you don't see familiarity in certain areas. Yeah, and I think BMI was another big place too. Like as I progressed throughout the years, just like mentoring in BMI was huge for me. Like staying connected, to school and stuff like that. So yeah, I think that's what I would say.
Yeah. So I definitely think you mentioned a couple interesting things there.
Yeah.
I think maybe first, I definitely say one thing that, like you mentioned how, especially even before, of course, getting to the point of being a physician, earlier on, like in that training path, how you were able to find opportunities to kind of make that impact, connect with people, get out in the community, reach out, different things like that. I even actually had like a guest on the podcast where we kind of went in depth just talking about really the importance of like being able to like be hands-on and help people out, in the community that need it the most.
Dude.
And I know I'm definitely thinking a lot about how I can especially make the impact when I get to the point of being a physician. And, I can also definitely try to do that like along the way, as I'm mentioning. I do kind of wonder, for you at least, now that you're like at that point of being like a working physician, how do you feel like you've maybe been able to integrate that aspect of things and taking their community, like now that you're at that point?
So it's definitely busy, and as you know, in med school, you make time for the things you care about, because you're gonna have downtime to chill. Like your downtime is very limited, but you will have it, and it's all about prioritization. For example, myself, I have a couple things lined up. I've been working with this organization, essentially that works with like domestic violence, survivors of domestic violence, gender-based violence, and I do plan on lecturing medical students at Mount Sinai about how to treat patients who have suffered from like domestic violence or survivors of domestic violence, how to approach these kinds of situations with care and dignity and like being more conscientious. So that's one way I'm still kind of involving myself with that. I'm going to lecture med students in that area. My clinic right here on 125th, we have clinic like every 6 weeks or so. Where we like do like primary care.
Oh, that's cool.
They just started up actually this like exercise program like once a week. So like I'm gonna try and like get involved with that as well, where I teach like how to have like exercise and stuff like that, or I teach like hypertension management and like stuff like that. So I'm trying to stay connected. It also helps me to stay relevant too in terms of like my medical knowledge. So like it's like kind of applying both at the same time.
Okay.
Yeah, I think that's it for now, but I'm definitely going to keep working on things as I progress, but I got a couple things lined up.
Yeah, no, that's definitely huge for sure. Like I'm thinking, like even the thing you mentioned, like domestic violence training, like that's something for whatever reason I never even would have thought about.
Yeah, I noticed that there was a lack of that in Sophie. I tried to get like an initiative going, but it never really took off. But that's definitely something I'm passionate about. So
we definitely, I think, need a lot of that.
It's huge, man. Yeah. It's huge. It's more common than you think, because a lot of people, especially in the minority communities, survivors of this domestic violence, they keep it on the low because they protect the family first. They suffer in silence. It's frowned upon to like speak up about it. A lot of times the survivors or the victims of this kind of violence, they don't feel empowered or they don't have any agency to really do anything about it. It's really hard to tackle that. So I think as a physician, you should be able to recognize these things and really have a good approach to like helping them out. We see this stuff in the questions, like like we know the answers to the questions, but in real life it's different, you know. So it takes a whole nother skill set to kind of tackle that.
What I probably want to ask you about that as well is, do you feel like when it's come to, obviously you're teaching some of these things now, do you feel like as you've kind of gone through your training and gone to the point of being a physician and continuing through residency and stuff, did you feel like sort of the situational awareness for those types of things and also kind of like the community impact you mentioned were things that maybe had to like grow more over time, or did you feel like you kind of had a handle on it, early on?
I kind of just threw myself into it. Like, I don't know. I'm the kind of person that likes to prepare a lot for things, and then I realized throughout my experience, Sophie, that you just jump right into it. That's the best way to do it. Of course, I didn't start teaching immediately. It was more like I exposed myself to certain things. I went to like different lectures and different experiences. Start small, work your way up. Start with what you're comfortable with, but definitely just take the leap at some point, because you're not always going to be completely ready. It's something that if you're doing something new, it's going to be very nerve-wracking initially. Have a support behind you. Have like a supportive team. Take feedback well, constructive criticism. Yeah. I did a lot of my own research on the side too, so I can become more proficient. Like I try to look things up and stay relevant, stay current on many of the things I talk about.
Moving a little bit forward and kind of off of that point, in terms of the amount of time that you spent, through that training process and everything, how did you feel like, I guess, the actual portion of your journey that existed in medical school kind of went for you, and what was that like, building like the clinical knowledge, building like the the foundational knowledge, but also being able to get to a point where you're able to like apply it well?
Yeah, honestly, let me see. The foundational knowledge was definitely like important, but like it's funny because like it's like learning a language. I feel like med school is like learning the language, and then maybe M3, M4, but definitely residency is actually doing it. Like once you graduate, you realize you don't know anything. You don't know anything. Like like medications and like the path. How mechanisms work and like the book smarts. But like when you get outside, you don't know anything, bro. And it's like I don't know. It's just like different. There's a lot of nuance to everything. Every patient is a whole different like picture. Like I think in med school too, like because you're learning by organ, like organ system by organ system, it's very isolated. But in real life, you have to take everything. You have to look at everything and how everything relates.
Yeah.
And it becomes easier with time. Like you start developing pathways in your brain, and then you start making connections. It just gets easier. But I think med school is definitely good for foundational learning. M3, M4 is like when you start transitioning into that new mindset of actually applying everything. Let me see. But yeah, I think the foundational stuff, I feel like it gets like the first aid gets thicker every year, man. So I'm like,
I can tell you firsthand.
First aid
the 2024
like,
textbook.
Yeah, it's like I don't even know, man. Like they expect you to know so much now, and then the tests keep changing. Like step 1 is like pass fail now.
Yeah.
Step 3 I heard is going to be pass fail.
Really?
Maybe. Yeah. I saw that somewhere.
Okay.
So like everything's just changing, and like the way they phrase the questions too is all different because everybody knows too much, so they keep changing things that we don't really expect. So I mean, it's whatever, but I think the journey to like being able to apply the medicine, like it's pretty good. It's pretty good. I guess you'll see with time. It'll come with time. The confidence will come with more exposure. I think medicine is like you really ripen with age. Like your peak is as you get older, to be honest. And like as a second year resident, I feel so much more confident than last year. 10 times more confident, and that's 100 times more confident than a student. 100 times. It's a whole. It's huge. It's huge.
So based off of that, I actually have a bit of a question then. So, do you feel like there's anything that medical schools could do better to prepare people for that sort of transition, or do you feel like not
honestly,
so much?
I think practice of medicine, like the humanitarian stuff, is pretty good. The medical aspect, I don't even know if there's much you can really do because it's really hard because you're coming into it with no medical knowledge or almost like minimal medical knowledge. So you have to learn the basics. There's not really much around that.
Yeah.
And learning the basics for the first time is really hard because you learn. It's like learning a new language. So it's going to be really hard to learn everything the first time around, and then be able to relate it all together. Because when you're learning pulmonary and then you're learning cardio, like they're heavily related.
Yeah.
But when you're learning each one individually, it doesn't seem like that in the moment.
Exactly. Yeah.
But like in a couple of years, you'll see like cardiac and pulmonary, they're like the same thing. They're very related. Very related.
Yeah.
Same thing goes to the kidneys, and they're all like there's a huge system. They're all just together. I think what helps a lot in medical school is like teaching, like the students teaching, like giving kind of like those PBL where we like had a topic to present. I think that helps a lot because when you present something or you teach something, you're forcing yourself to know it. Yeah. And you have to know it to be able to present it. So like that's like a whole like learning strategy, which is really cool, I think. So I think that's good. I think probably the best thing you can do is like have a patient case, like something that's based off a real patient that you might have seen as an M3 and M4, or even like if you're shadowing as an M1 or an M2, or like a real patient case, and break it down from the beginning. Like when it first came to the ED, like what would you do? Like patient comes in with X, Y, and Z chief complaint. What do you think is going on? Like someone comes in with chest pain and dyspnea, exertional dyspnea, leg swelling, this kind of stuff. What would be the first thing that comes to mind? So now you have the cardiac bucket, the pulmonary bucket. What do you want to do? Chest X-ray, EKG. I think this kind of stuff is good. And like, don't just give the answers right away. Like, elicit it. I think that's great for students because that's the kind of thing you're going to be expected to do in residency.
Yeah. No, I think that's definitely like I love the way you kind of like. I think the way you worded that was for sure helpful for me. Yeah. Just because I think I've heard that from quite a lot of people who are like further ahead on the medical path about how really like there's a lot of integration that goes into medicine and ultimately I guess I would definitely assume, especially off of what you're saying, is like you have to be able to take the information that you're going to learn at kind of the stage that I'm at right now, be able to integrate all of those things, which I'm also like trying to learn to do, and be able to translate that into like, hey, this is actually what it's going to look in real life. It's like in real life, you're probably not just going to get like a small practice question where it's just chest pain. It's like it's going to connect
to all different pieces things, man, all different things. So yeah, that's what I would say.
Yeah, that's definitely helpful. So going a little bit further on like the med school point, what do you feel like was one of the most impactful, if not the most impactful, maybe like lesson or experience you feel like you got from medical school?
Med school, let me see. I feel like I have a good amount. Like there's a couple of different ones. It's hard to say the one big one that outweighs everything else. I think definitely a sense of community is huge. Nobody does this by themselves. It's huge to have a sense of community in terms of like people to have fun with, people to like keep you accountable in your studying, people who have like the same like wavelength in terms of like you are who you surround yourself with. You know, I was fortunate in that, you know, a lot of people in my class, we all were like very like gung ho in terms of like type A energy. We were all like always trying to like get publications and like we do research. Like we were always like just trying to do stuff and better ourselves.
Yeah.
You know, we're always trying to like be very well-rounded people. And that energy kind of just rubs off and inspires you. So I think keeping the right company is huge, and I feel like that goes for the rest of your life. Like just having the right company around you, because you are who you're with. That's what I learned. Another thing is resilience. You know, med school is rough. It's not normal. It's not normal.
Wait, it's not.
like all your friends who are not in medicine, like they have like breaks and days off, and they're like, oh, like why don't you want to come? Like you were studying yesterday. You're studying all week last week. Like. Like, oh, you got another step. Like, how many steps are there? Like, you know, all these kinds of things. I
get that a lot. Like,
again, another one. Like, and then you have to explain these things. So it's like the resilience to just stay committed to what you're doing. Like, because I know a lot of people have second thoughts, especially when it gets really hard. But you have to really just stay committed. If you really feel like this path is for you, you know. I guess being black in particular, it's like a unique experience. Like that's part of my motivation for doing this, you know, to be there for my people, and that is definitely something that grew within me during like undergrad and med school. Yeah, so I think that's another big takeaway for me, like the whole like being black in medicine, being a black man in medicine. That's really like it's a very different experience. I can get into that a little bit later, but it's a whole different experience. Pretty unique.
Yeah, okay, so. In fact, let me actually ask you a little bit on that point, because I know I can definitely speak like for myself and for I think part of the vision of this podcast, especially even like with one of the themes of it really being like less than 3% as a title and all of that. I've definitely been trying to be able to give a model of the benefit that can come out of having, you know, a diverse and a culturally competent healthcare system. And I definitely think, of course, that even myself as a black man, like I think having more black physicians involved in that is also a key part in being able to, you know, have a healthcare system that's able to function that type of way. So I definitely want to ask you, for you, what do you feel like is, because I know you pointed at this quite a bit, you know, throughout the podcast, what do you feel like is the significance of being a black man in medicine, and how do you feel like that's maybe been able to play a role in terms of your journey through medicine and what you're doing? You know, if you could expand on that.
Yeah, honestly, like that extends to from undergrad to now. It's like it's been my whole journey, honestly. But I guess I'll touch on residency primarily because I've talked about school a lot. The significance is that, firstly, the patients, there's a different dynamic. A million times I've gotten, oh my God, I'm so happy you're my doctor, from my black patients. It happens all the time. I've gotten remarks like, oh, I have like one of my pregnant colleagues like, oh, I wish my son would like grow to have locks like yours, you know, stuff like that. And I feel like a lot of times the patients are more comfortable. They're more amenable. I've had difficult patients, like in the chart, people write difficult patient.
Oh, they really write that in the chart.
It's in the chart.
Oh, wow.
So it automatically ascends like a stigma.
Yeah.
You know, preconceived notion of like, oh my God, this guy's gonna be annoying. Like, so you come in the room like, oh my God, but then I'm sitting down talking with them. I'm like, nah, they're just like black and misunderstood. Like, you know, like that's all it is. And it's like I just be vibing with them and it's fine. So like I feel like that happens a lot. I think one particular anecdote too is that there's like the cultural significance is big too, because one time I was in a critical care unit, and in critical care the patients are like usually in comas, or like they come in and like they're unconscious, status was cardiac arrest, stuff like that, or they're barely awake, and if there's any slight decrease in mentation, we get freaked out because it's ICU, you know, like any change in mental status we start freaking out. One lady comes in, she's Haitian, nobody knows that she's Haitian because I'm the only black person there. I look at her name and I'm like, oh, that's like a Haitian name, you know, like everyone's talking to her. She's not waking up. Like she was fine like an hour ago. Like everyone's freaking out. This is like in the middle of the night. I come into the room. What did I say? I'm not even Haitian myself, but like I know like one or two words in Creole. I said something. I was like, Mademoiselle, like sac passe, some nonsense. Like, I said something, and then she woke right up, and she was like talking in Creole, and I was like, this is all it took. The whole unit full of all these people couldn't wake her up. They were talking in French, English, nothing. And I was like, stuff like this, these little things, they really matter in the end, because it would have changed management. We would have thought she was like unconscious or something. We would have got like unnecessary testing for her. All you have to do is just take your time and really just make sure everything's okay. But that's just one small anecdote. There's plenty of other experiences like that. I was once used as a translator for one of my Caribbean patients. It was kind of funny. Yeah. So I think that was pretty significant. Yeah, stuff like that. Yeah.
Yeah, no, that's definitely a lot there for sure. So I know we've talked a lot about number one, like your journey through to the point you're at, medical school, even some of the things with residency. And I definitely want to ask you even a little bit more about that. I think for myself at least, like I definitely keep an open mind in terms of like what I'm thinking about for the future is like specialties and what that's going to look like for me and my career. I will say that I definitely think internal medicine, is kind of like very much on the radar for me. And obviously like you're an internal med physician, you've been a resident for like over a year now. So you kind of had like quite a bit of experience with it. How do you think that has been for you and even like the transition
internal
to
medicine?
residency? Yeah.
Internal medicine's been cool. So yeah, I mean, for those who don't know, like basically the way it works is that you come to the ED, you get evaluated in the ED, and they decide, are you stable enough to go home? Like after a day of watching you, can you go home, or do you need to get admitted for further management of whatever you came in for? In internal medicine, we're the people who will basically manage you for more than like 2 days or so. So generally speaking, 2 to 4 days, 2 to 5 days is what we do. So in terms of how it's been, I mean, it's been cool. We have floors, which is the main bulk of it. We have one ED rotation for like a month. We have a bunch of ICU rotations. Okay. It takes a while to get used to managing many different people with many different things going on. Okay. But I think it's good in that sense because you take ownership of your patient. So the way it works, you have 2 interns to a team. Sometimes you might have either 1 senior or 2 seniors, depending on the program. But yeah, usually it's about, I would say like 8 to 10 patients per intern. It seems very overwhelming at first, but you have a lot of support from your senior, and the attending also has a lot of oversight. So it's like there are a lot of layers of supervision. And yeah, first month I almost cried, man. It was rough. First month is like, it was rough in the sense that you're new to everything. You don't know anything. Like you feel so stupid. And then everyone's asking you about like answers for things. Like everyone's asking you questions. You don't know the answer to them. And it's just like, it's hard to like kind of really get the ball rolling. But once you do, you feel okay. And that's a common feeling. A lot of people can relate to this. Like the first month is terrible no matter what you do.
Oh, wow.
But yeah, I mean, you get used to it, honestly. And I think the more ownership you take over your patients, the better it is. I would say like maybe pick 1 patient if you can and do up to date on all their conditions. Like just look into the management of all of it. Pick like 1 a day, just to like really go a deep dive into like what kind of management you would do.
Yeah.
A lot of learning on the job. That's huge. A lot of learning on the job. I think internal medicine is pretty cool because you get a wide array of things. It's not like a narrow scope.
So yeah, I definitely think that's interesting for sure. I think one of the things I think about in terms of maybe some of the interests I have with internal medicine is kind of being able to see like kind of a broad range of conditions and how it can help a lot of different people in a lot of different kinds of situations.
Oh yeah, for sure.
So yeah, I think that's one thing I'm also trying to get.
And I think for me too, it was very gratifying because you kind of stay with them and you see them improve throughout the week, which is probably one of my favorite things. Like they come in, decompensated heart failure or something, and then they literally improve throughout the week. Like it's a great feeling. Very gratifying for me, honestly. Seeing that impact.
Yeah, No, that's I definitely think major for sure.
Yeah, man.
So I'll definitely keep that part in mind too. Now there are a couple more questions I want to ask about internal medicine,
Oh yeah.
but it's a little it's a little more interesting, I think.
Oh.
So
Oh.
so I think the first thing is so I hear this a bit, I hear people talk about it, and I'm like almost in like a rumor type of sense, and I'm like, is this actually true? And I kind of got a doctor on the podcast to answer.
Oh, let's go.
But like, so I do want to ask about the 24-hour shifts. Ooh. Like, is that like a
is that real?
Real thing?
Yeah, 24-hour shifts are real. Not in my program though. But they're real.
Okay.
Depends on where you go.
Okay.
Yeah, my program, the most we do is like, I don't know, like 7 to 8.
Really?
Yeah, it's like a 13-hour shift. That's like the longest we will do.
Oh, okay.
Actually,
okay.
I'm wrong. The most we'll do is like, yeah, no, it's a 13-hour shift. Yeah. 13-hour shifts. That's the most we'll do. But I know other programs do have 24s, but then you get like the next day off or whatever.
Okay.
I don't know. I feel like it's fake because you have to stay a little bit longer. Yeah, it's kind of
annoying. Okay.
So yeah, that's definitely real.
Yeah.
But that's more common in the surgical specialties though.
I see. Yeah. I see. Got you. So how do you feel like balancing that with, whatever other aspects of life has kind of been for you?
Honestly, like, it's not bad. It's not bad because there's less studying. Well, when I say there's less studying, like med school, you're studying. Like, you're studying,
Full sessions. Yeah.
During residency, like, the studying is like, I'm just going to go on up to date real quick and, like, just quickly, like, look over the management of this condition. Like, that's, like, the studying. Like, it's not, like, hardcore per se because you're kind of learning on the job. And then you review going on up to date or whatever other source you might use. So the life balance is a little bit better. The days are long though, and when you're at work, you're working, and you're tired. Like you're physically tired, you're emotionally tired, like you're just tired, because you're giving yourself to your work. You're really just giving yourself emotionally. Like you're having goals of care discussions, end of life discussions. Dealing with patients who might be agitated or they have like very negative experience with the healthcare system, and then they end up unfortunately taking it out on you. Like it's nothing personal, but like you just become the face of medicine, so they're going to use you. Like a lot of these different things every day, so it's like it's very emotionally draining. You have to separate yourself or else you get burnt out really quickly. So once you get home, a lot of people just chill, man. Like it's just really like it's very needed.
Yeah. So even going off of that, because you mentioned really kind of like all the different things that go into just like a regular day in terms of, what you particularly do. I do want to ask you, what do you feel like was perhaps the most or one of the most memorable experiences you've had like with like a patient encounter, without violating HIPAA, but like, yeah.
Most memorable. I have a couple different memorable ones. Let me think. Most memorable. I have a couple. So one day I come in, and my patient's in the ED. So they didn't get a bed yet upstairs. They're still in the ED. I literally just like signed into the computer. I got like 10 messages because I got assigned to the patient before I even got in. So like everyone's messaging me like patient's agitated, blah blah blah. Like they're asking for pain meds. I literally was like I didn't even get a chance to read the chart. And then someone's calling me. They're like, "Yo, we're gonna call a rep if you don't get here. If you don't get down here soon." And I was like, "Bro, like I don't even know what to tell you." Like, and like the way it works too is that once they're assigned to medicine, the ED team is like very removed. They're very much like, "Yo, this is your problem now. Like you deal with it," because they're also very busy.
Yeah.
Like they're very overwhelmed. So it's like, I get there, this patient like they're very upset. They take her smearing it all over the floor and the wall. It was crazy. And then everyone's looking at me to do something. And I was like, bro, I'm just an intern, man. Like, it's just my first. This is literally like my second month. Like, bro, like it was crazy. Stuff like that. Honestly, stuff like that is just jokes. Like, another time, one of my patients, similar story where they wanted pain meds, and the team, we were discussing it. We thought they might have been malingering. We thought they might have been like had some kind of secondary gain from it. So we were like, nah, like you're. This is not you don't have a pathology right now, like you're just kind of seeking medication. And then we walk away. One of the nurses spots the patient inducing vomit. Like they put their finger down the throat, inducing vomit in the bag. I come back to talk to them, they start shaking the bag like this. They're like, "Oh my god!" Like they're very upset, shaking the bag, and they throw it in the air, and the vomit splashes on the security guard. Bro, I felt so bad. I felt so bad. It was disgusting. So I'll never forget that.
Wow.
And then more on the pleasant side.
Okay. Yeah, I was gonna ask about that.
More on the pleasant side. One of my patients, basically like very convoluted psych history, doesn't trust anybody. Like it was very hard to interact with them. It's one of those things where you have to like become their provider throughout, like with familiarity. A lot of these kinds of patients do well with familiarity. So I saw this patient every day, same time every day, same questions, same everything, just to keep regular stuff, very predictable stuff. Yeah. And I thought it was cute because they only wanted me there. Like every time I left, they would start freaking out, headbutting people, biting people, and then I'll come there and then they'll calm down. It was very cute, I thought. It was nice. And it got to the point where I had to get a computer and just kind of like stay with the patient on the floor and just do my work next to them. Yeah, I thought that was cool. What else is there? I'm trying to see if I have any cool ICU stories. I don't think I have anything cool in particular from the ICU. I guess one time a patient gets transferred from like a different facility. Basically, they had a heart attack.
Oh, okay.
And that facility didn't have the capability to do the standard treatment. So they gave something that was non-standard. Oh, this is my first time experiencing this. I was like blown. Like basically they come in and usually you're supposed to do like a cath, all that kind of stuff. They didn't have the capability to do a cath, so they did TPA instead.
Okay. Yeah.
So this guy starts having a massive GI bleed. Like it's crazy. It's crazy. Like the bed is like a river of blood. And then it happened like 3 times overnight. And so it's just me and my senior. And we were just scratching. We were like, yo, how the hell, like, this is OD. Like, we were like, yo, like, this person. I think that was one of the craziest nights for me because we were literally just, like, so scared. Like, the blood pressure was, like, 70s, 80s, systolic the whole night. Like, oh, my God. Okay. It was one of the craziest things. Like, we were just, like, by the room the whole night just watching them. Like, they had, like, 3 episodes of massive GI bleed. We couldn't do anything. Like, we were transfusing them and just kept on bleeding, kept on bleeding. It was crazy, man. It was crazy.
Oh, okay.
And we were just kind of keeping them alive until the morning.
Yeah. Oh, okay.
Yeah.
Wow. Yeah.
So I think that was pretty memorable for me. Yeah.
Wow, yeah, that's interesting for sure.
Yeah. No, the ICU has a lot of stuff.
So actually, I do want to ask about this. So I did a previous episode of the podcast a while ago, probably around a year ago, on this topic. But it's one of the things I've been wanting to look into a little bit more, and I haven't had the opportunity to like actually ask somebody who's kind of experienced to some extent some of those things. I think I definitely hear a lot about like intern year, especially particularly when it comes to, I guess, like the wellness aspects on the part of like a lot of residents and stuff like that. Like, I think the episode I did previously was like a little bit of research on what was going on with like residents like unionizing and stuff. And so it seemed unionizing. So I kind of hear a lot of stuff maybe on like the controversial side about like how intern year is for people, or even just people like sharing their experience and stuff like that. Unless you maybe feel like you touched on this already, how have you kind of felt about like the way intern year went for you and like kind of the way that's usually run,
Yeah, I mean, it highly varies based on the program, but I've heard some programs are quote unquote malignant or toxic, a lot of these things. Overall, intern year generally is the worst year, is what everyone says. The reason why they say that is because you're new to everything, you're learning, you're kind of bottom of the totem pole, stuff like that. You write all the notes, which is a drag. It takes forever to write the notes. You do all the digital rectal exams, stuff like that. You're just at the bottom of the totem pole, like, that kind of thing. And like learning the way of medicine, like it's really an art, honestly. It's an art and a science at the same time. It's like there's a lot of nuance to it. But in my personal experience, my intern year was not that bad. Okay, so we had one elective, and the rest of it was just like floors and units. Second year we had 5 electives.
Oh,
so see the
okay.
difference. Yeah,
Yeah,
see the
that's like
difference
a jump. Yeah.
One elective
Okay.
to 5. So it's a big jump. A lot less work in general, but intern year overall to me was okay. I love a lot of cool people. The program was cool. It's really what you get what you put in,
Mm.
because at this point it's a lot of it is self-directed learning, as you've been doing during med school. But this is like some real self-directed learning. Like you can really just get by easily. But if you really want to excel at your craft, you want to be like that one that,
Yeah.
like, I try to imagine, would I refer myself to somebody? Or like, would I trust a family member or a friend in my care? You know what I mean? That's the kind of way I look at it. So like, you have to really push yourself to be self-directed, because no one has time to teach you anything. If they teach you something, it's like short, or you're not gonna remember it because you're tired as hell. No one has time to hold your hand. So you really gotta take it upon yourself to, like, stay up to date on articles. The management guidelines of things change all the time. Yeah, just stay current as much as you can, honestly. And just everyone comes with a different skill set too. Everyone excels in different things because everyone's coming from different areas. People from different countries are like attendings in their home country, and now they're coming here as an intern.
Oh, okay.
So it's easy to compare yourself to people who have a lot more experience.
I see.
And then you get like imposter syndrome, being a black person as well. Being the only black person around is very easy to fall into imposter syndrome.
Interesting.
The culture shock could be a little bit different as well, depending on where you grow up. Yeah, a lot of things to get used to.
So to kind of go towards like wrapping this up, I do ask you a couple more things. So what would you say are the goals that you really have for the future? Obviously right now, like second year residency, where do you ultimately see yourself going?
Yeah, ultimately I do plan to pursue critical care medicine, probably pulmonary critical care, because critical care is like, you combine it with other things like pulmonary, ID, neurology. So I'm going to do pulmonary probably. That's my ultimate goal. I want to continue pursuing, like, the community outreach and stuff like that, the community involvement. That's still big for me. Yeah, I mean, maybe I would like to practice in New York. Yeah, I mean, I can see myself teaching too, like in a teaching role. Like an adjunct professor or something like that. That's something I'd probably dabble with the idea of. Yeah, that's what I would say.
Okay. Yeah. So last thing I want to ask really quick, with this podcast, I always definitely try to be able to speak to things that can help out people who are maybe also along the medical path, whether they're where I'm at or a little bit earlier on pre-med, or people even further along, that path and everything. And I think definitely having you as a physician on the podcast is definitely going to inspire and help a lot of people out who are listening to it. I do want to ask you if there's one piece of advice that you would have for any aspiring physicians who are looking to get to that spot. What piece of advice would you give them?
Advice. Let me see. It's kind of individualized depending on the person, but I guess if I could come up with a general statement, drink lots of water. Stay hydrated, bro. It's hot.
Yeah, especially right now.
Honestly, just take care of yourself. Like it's not worth destroying your body over this. It's really not. Like, just take care of yourself at every part along the way, whatever that means to you. For me, I like to exercise. I like to spend time with friends. Like, it refills my tank. So whatever refills your tank, just keep it up. Every year of life just gets more and more responsibilities. Like, there's always going to be something happening, and the sooner you learn to cope with the stressors of life and still live, the better. The better. Because life doesn't slow down for anybody. Yeah. And even myself, I'm only like 26. Like, what do I know about life? But I know enough to say, like, it doesn't slow down. You gotta find a way to maintain yourself.
Yeah. Definitely. So, definitely appreciate you coming on the podcast.
Yeah, man, it was a good time.
It's been great.
Cool.
I can definitely say, I did a doctor interview now.
Yeah,
wait
bro.
for that. So.
Yeah, it's gonna be you soon.
Yeah,
got a couple more years,
Yeah, so I definitely appreciate you taking the time out because I know it's like busy, and everything. So
for sure, man. Appreciate you having me on this podcast.
Yeah, of course. So so really that wraps everything up. If you're still listening to this episode, make sure you go ahead. If you're watching on YouTube, like, subscribe, hit notifications. share it with somebody. You know, if you listen on Spotify, go ahead and follow wherever else, other platform. And with that being said, that wraps up this episode, and I'll see you in the next one.